Greetings, my name is Sharon Dizon, and this is my presentation for Course Making Evidence-Based Decisions. I am going to focus on the topic of remote collaboration and evidence-based care relating to the Villa Health scenario to meet the best practices for improving safety and outcomes. In the United States, it has been reported that about 20% of the population lives in rural areas where they face scarce access to health care, posing disparity. According to the study conducted by Chandro et al., published in 2022, this disparity exists due to four major factors: social factors, economic factors, health behaviors, and physical environment. For healthcare providers, we may not be able to assist our patients in all four factors. However, we can most certainly prioritize nurturing our patients' health and wellness behaviors, enabling them to overcome the disparity. In the case study presented on the Villa Health remote collaboration, Caitlin, a 2-year-old girl, was diagnosed with cystic fibrosis. She is currently residing in a rural area and is faced with challenges due to inadequate medical services. Cystic fibrosis is a hereditary disorder affecting the exocrine glands, making the body's mucus thick and consequently leading to blockage of the digestive system and respiratory system. This disorder requires consistent and lifetime multidisciplinary health care. In this case, a technological-based approach can bridge gaps in the accessibility and obtainability of Caitlin's medical care. The first part of the care plan is advocacy and the provision of supplemental medical monitoring equipment. In a study conducted by Compton et al., published in 2020, determined the need for the provision of monitoring equipment such as blood pressure monitors, portable spirometers, weighing scales, and pulse oximeters. These devices and equipment, alongside the proper caregiver education on proper use, can boost the success of remote patient care. The supplemental weekly logging of lung function in conjunction with the usage of equipment can greatly assist patients and caregivers in symptom recognition, improve treatment adherence without burden, and prevent adverse reactions. The second part of the care plan is an emerging intervention and has good functional outcomes among cystic fibrosis patients. This is called whole body vibration training. This is a new type of exercise that has been found to be efficient in initiating and activating muscular activity, ultimately leading to improved physical function, pulmonary function, muscular performance, and balance. In 2019, Alexander et al. Found in their study that the use of whole body vibration training in telehealth medicine on cystic fibrosis patients dramatically reduced travel time, decreased hospitalizations, decreased overall medical costs, and increased patient quality of life. This training requires the skilled need for pediatric physical therapy to assist in the integration of Caitlin's gross and fine motor skills during the training. The third part of the care plan is through technological integration of both secure messaging and video software linked within the electronic health record systems to augment healthcare communication. In a study conducted by Chandra et al., published in 2023, it identified that secure text and video messaging among remote care patients aid in real-time accountable messaging responses and interdisciplinary coordination alongside the provider's corresponding patients. This reduces turnaround time during emergency situations, such as correcting medication doses and other critical care coordination. Secure messaging is continuously emerging and advocates functional engagement among patients and healthcare providers while adhering to HIPAA compliance. This is something that can apply to assist Caitlin's management of health, specifically when the parents are unable to connect to the internet right away, they can use their cell phones to communicate directly to Caitlin's clinicians and get real-time answers via secure text messaging. During my formation of the care plan, I had the privilege to use the Ottawa model to assist in identifying and applying research, enveloping a 6-step strategy that guides the practice of transferring research into practice, setting the stage, specifying the innovation, assessing the innovation, selecting knowledge translation strategies, monitoring innovation adaptation, and evaluating of outcomes of innovation. Using this model, I was able to locate literature that is beneficial and can significantly fortify remote collaboration and improve outcomes for the case study. The framework for interdisciplinary success in remote patient care is through collaboration and effective communication in the case study. Collaboration is evident. However, an opportunity I see that could have been implemented to fortify patient or caregiver education and autonomy is through the teach-back method. Yen et al. 2019 expounded on the teach-back method as a unique technique used to confirm the percipience of patients on health information and intervention. This method strategizes on taking universal precautions for health literacy and has been endorsed by the Agency for Healthcare Research and Quality and the Institute for Healthcare Improvement. The process includes asking patients or caregivers to repeat the instructions rendered by the multidisciplinary healthcare providers to assess patients' understanding, modify, reteach, reinforce, and re-emphasize certain interventions and instructions until functional patient and caregiver autonomy is met. When patients and their caregivers understand the current health situation and hear uniform education and information across all disciplines, it facilitates better healthcare outcomes and compliance. Overall, multidisciplinary collaboration improves the quality of care and bridges the gap for rural and underserved communities. Patients can eliminate the wait for providers visiting the hospital or clinics, and other care providers, including the patient's family, are able to conference during the visits. Multidisciplinary collaboration also allows for comprehensive care treatment with each discipline, focusing on each body system that is tailored to the patient's needs. Collaboration does not only mean among healthcare providers, but rather means communicating and cooperating with our patients and their caregivers. After all, it addresses nurturing our patients' health and wellness behaviors, enabling them to overcome any disparities.